Hi, my name is Leah Pearson, and this presentation is for my Addictions Family Counseling course in the Human Services with a focus on Children and Families program. And today I will be presenting a case study analysis of the movie Four Good Days made in 2020. And this movie explores the impact of opioid addiction on a mother-daughter relationship. The main character, who would be the client, Molly, is a 30-year-old woman who has had a decades-long addiction to heroin, and she has relapsed multiple times, and it focuses on her relationship with her mother, Deb. Molly's mother, Deb, really struggles between differentiating between supporting her daughter's recovery and enabling the behavior. So this movie focuses on a period of 4 days where Molly has to get through detox and a deal she's made with her mother to receive a Vivitrol injection to help block the cravings and get her through recovery without relapse. So to better understand this family, it's important to look at the family roles and the dynamic. So first there again is the addict, who would be Molly. She is really just the center of the dysfunction in the family, and her addiction is what really feeds the dysfunction and the destabilization within the family. And then Deb would play the enabler and the caregiver. And while she tries not to enable, she is torn between just leaving her daughter to do this on her own and wanting to help her, but struggles with the boundaries again. And then her father is in this movie, but he plays a very detached family member, so he is not involved very much within Molly's recovery. Um, we do see, as we'll talk about later, this movie really focuses on a lack of boundaries, codependency, and not very good communication skills. So some theoreticals, some theories that would help us again understand the relationship in this family. First, there would be the Bowen family system theory. A big one that we see is Molly and Deb both not being able to differentiate between their feelings and their thoughts, so or be codependent of each other. So Deb really struggles with separating herself from Molly. If Molly is upset, Molly's crying, Deb often reflects the same emotion, and she seems to struggle to kind of think and act independently of her daughter's pain or her progress with recovery. But then you have Molly in return, who is very dependent on her mother's reactions to feed her own, and what seems to kind of stimulate her own self worth and self value is how her mom reacts to her. Um, so when neither of them are able to differentiate their thoughts from their feelings and separate themselves from each other's emotions, it kind of just feeds into that vicious cycle of nothing productive or healthy coming out of it. So it would definitely be a priority to teach them how to do that so it doesn't becomes more of saying how you feel and not what you think. Um, Another thing with them is emotional triangulation would be very important to understand how that works between the two of them. It seems that Deb triangulates to her husband when things aren't going well with Molly, whereas Molly seems to triangulate to drugs as an outside source rather than coming to the family members with her problems. So it would be important to understand that aspect of the relationship. It would also be really important to understand how disorganized the family roles really seem to be, the family structure. Despite Molly being the child of the family, she really holds a lot of the power in the house. And then where Deb should be the parent and the one holding the boundaries and the power seems to almost just release it to Molly, which is probably due to years of fighting this battle with her. It seems like she's kind of just surrendered to it. Um, and then lastly, it would be really important to understand Molly through motivational interviewing. Um, it seems like in this movie, she has really ended up wanting to change or being motivated to do this detox due to her mom pushing her and ultimately not giving her another choice. So I think it would have been really nice to kind of get more from Molly and where she was personally at with being willing to change rather than just seeing it through the lens of her mom pushing her into it. Some assessments that would have been nice to see used on Molly would have been the DSM-5, so the criteria for opioid use disorder, just used to assess the severity of her addiction. There's the ICD-10. We've learned that a lot of mental health issues and physical health problems can come along with addiction. So using that to use as a standard for diagnosing any of those other kind of onset problems that come with addiction. There's also the SAD person scale, the SAD person scale. Um, Again, we know mental health often follows addiction or pairs with it. So using that to kind of just assess Molly's risk level to herself and to others, and to just be able to monitor her mental health and see where that is at. And then lastly, an assessment that could be used is just like the motivational interviewing, the stages of change, kind of just to assess Molly's, again, her readiness to change and where she's at and her thoughts on that. Some of the treatment models or interventions that I would have used would be the behavioral family therapy. Um, Again, kind of falling back to the family clearly really struggles with communication. They don't really seem to have any problem solving abilities between them because they lead with emotion and it just leads to further conflict. So, really using the behavioral therapy to get through that and help them to learn to communicate efficiently. And I think that would pair really well with cognitive behavioral therapy. Specifically for Molly, it would get through her cognitive distortions of I've relapsed too many times, I can't do this, I can't cope without drugs, to kind of shift her mindset and her thinking. And then also for Deb to help her identify where she's feeling guilty, her thinking she caused it, she failed her daughter, if she doesn't help, XYZ will happen. So just to help her get out of that mindset and also to teach her some healthier and more helpful for Molly coping skills and building up her tolerance for distress and for seeing Molly in distress so that she is able to hold those boundaries because she's definitely in need of boundaries with Molly to help get her through addiction or, sorry, through recovery. Another thing I would use is the 5 Ps of the addictive cycle. We also learned that this is really important when it comes to helping the family shift out of blame towards the addict, and just getting a better understanding of what their loved one is going through, and realize that it's not, at the end of the day, it doesn't come down to just sheer willpower to quit. It is a vicious cycle that can be very hard to get out of. So I think this would really help lighten the blame between Molly and Deb and really give Deb a better understanding of what Molly is actively going through, and why it has been so easy for her to relapse. Um, I think the last 2 things that would pair really well with this duo would be a general psychoeducation, again, teaching Deb and Molly herself so she understands what she is also going through, about the stages and the cycle of addiction, but also help Molly understand that relapse is part of the process. It's not just a failure. Deb definitely needs to learn the difference between helping and enabling, and again, helping her learn how to set boundaries. And then I think it's also lastly important to understand that, again, it's not just a will problem. It also comes down to biological, neurology, neurobiology. So understanding that sometimes medication assisted treatment is also needed, but it also always needs to be paired with family therapy, cognitive therapy, trauma, and individual therapy as a whole. So I think using all of those things together would have really been helpful for this family because in the movie it really did just jump straight to getting this shot. So it would have been nice to see more in-depth treatment. Some of the barriers that I think this family would face would be a lot of distress, especially in the beginning of the movie. You can see that Deb is really hesitant with Molly and with even letting her through the front door. She mentions that she's stolen from her before. She's said she's going to do one thing, she does another. She uses her money for other things than she said she would. So I think that would be a very important thing to help the family through is learning how to trust each other again. I think another barrier would be shame and guilt, especially I think on Molly, but also on Deb, because we know it affects all of the family members. Everybody feels differently about having a member in active addiction in the family. It can bring a lot of feelings for everybody. And then also emotional burnout, especially from the father. You can see that he's done dealing with her, he's given up, he's fully surrendered, so he just stays very distant. So I think that would be another barrier that they would have to work through is rallying behind Molly to get her through this and not just leaving her. And then there's the overall more broadly and widely experienced barriers of like systemic issues of limited access to care. There's always going to be the stigma and just kind of lack of coordination and availability of help. So, after all of those treatments and therapies and possible medication combined, there's always going to be the resources that they need after for long term care and preventative care going forward. Some that I would offer if they were living in Florida would be on the Florida DCF, their Substance Abuse and Mental Health Services. They offer oversights for preventative care, for treatment and recovery. There's floridahealth.gov. They have the overdose data to action in the states, which helps locate treatment centers, providers, support groups, all sorts of great resources for long term recovery. Some national services, there is Family First Intervention. I thought they were very unique because not also do they also offer counseling and the usual like support groups, but they also offer like educational courses to the addicts, but also to their families. So I thought that was unique just to help them understand how to aid recovery and how it's not on them, and it kind of just takes them through a whole psychoeducation about addiction. So, to wrap up, I think Four Good Days really demonstrates that addiction is never just a one person problem. It always affects the others in the family unit, and it's more of a family disease than a singular person disease. And I think by using the theories like Bowen's family system, structural family therapy, and cognitive behavioral, it really just offers the best chance. Um, it offers to see both their dysfunction, but like the road towards healing as well. And I think the interventions that really blends individual recovery as well as family recovery and family healing also offers the best chance at sustainable change through the future and not immediate, easier to relapse. So the film does end up closing with Molly getting her Vivitrol shot after the 4 days of them struggling with each other and trying to work through their relationship. But the real work, obviously, it makes a point at the end of the movie, is them healing the relationship between herself and her mother, and it alludes to that road between them. Those long days have just begun. So I think it was a really good movie, and it lined up well with the theories and the interventions we're learning in this class. And I personally think as clinicians, it's going to be our job to help them rebuild these connections and these relationships with their family. And yeah, that is it. Thank you.